A 25-year-old male on his way home decided to take a shortcut through an alley. Shortly after going down the alley, our patient was attacked by a rival gang member.
Ah, fool! The ese got me! Puto chingad, puto! Ah, he was fast!
The attack was witnessed by civilians and they called police. Once police deemed the area safe, EMS arrived on scene. EMS arrives on scene and goes through their B-snack.
Okay, we have our BSI on. Our scene is safe. There's no more assailant. It looks like we have one patient. And the mechanism of injury looks like to be a stabbing. We want to consider additional resources, call for an ALS unit, and we are considering C-spine because the patient is unconscious. General impression of our patient looks to be a male, looks to be in his 20s. We can see stab wounds. Sir, what's going on today? He is semi-conscious, not really responding. Sir, my name's Kylie. I'm going to move your arms. And it looks, his chief complaint looks to be stab wounds, 2 anterior chest, 1 right upper quadrant. Sunny, can you hold manual stabilization? I'm going to check the patient's ABCs. Sir, can you tell me what your name is? Okay. Can you tell me what your name is? Okay. I'm going to check. He's moaning, so his airway is patent. I'm looking for equal chest rise and fall. Chest rise is rising and falling equally. I'm going to listen to breath sounds. Patient's responding to pain. Breath sounds are clear. I'm going to put the patient on high flow oxygen via non-rebreather mask. Okay, and I'll work around it. Okay, oxygen is applied. And I'm going to check circulation. I'm going to check his pulse. Patient has a pulse, it is strong. I'm going to do my quick 30-second head to chest scan. I'm noting minor bleeding coming from the 2 anterior chest wounds and the right upper quadrant injury. I do not see any bleeding or deformities below on his lower extremities. I'm going to check the back of the patient's neck for any step-offs. Does this hurt? The patient's not telling me that's hurting, but he's moaning, so I'm going to assume that it's painful for him. I didn't feel any step-offs, and there's no blood on my hands. I'm now going to measure the C-collar. It's measuring at about 4 fingers, which is a 4 on my collar. I'm going to apply the collar to the patient. And the collar's on straight, so I can still see there's no tracheal deviation and there's no JVD. Okay, because ALS isn't able to meet us here yet, we're gonna take him to the hospital. We've been on scene for 5 minutes. We're going to get him back ordered. Sunny, on your count, we're going to log roll.
Alright, I want to kick. 3, 2, 1.
And I'm checking for my decap VTLS, checking his bottom.
Alright, and back on 1. 3, 2, 1.
Okay, I'm cutting his shirt before we put his straps on, so that way it's easier to assess the front of him. Alright, I'm going to start by strapping in patient's torso. making sure the straps are going over his shoulders. Checking CSM. Sir, can you please wiggle your fingers for me? He's wiggling his fingers. Can you squeeze my fingers for me? And I did feel pulses on both sides. Checking his pedal pulse. Sir, can you please wiggle your toes for me? He is wiggling his toes.
The EMTs are now taking vitals.
Okay, the patient's strapped in. We got his head straps on. We padded the voids, and now we're going to lift the patient using proper technique. So, bending, keeping our back straight, maintaining eye contact on the count of 3. 1, 2, 3.
The EMTs are now going through a secondary assessment. Upon taking vitals, the patient has a heart rate of 120, blood pressure of 88/60, and his respiratory rate is at 30.
Okay, I'm checking his head for any deformities, any broken bone, any crepitus. I'm checking his cheeks. Okay. And can you lift that up just for a second? Checking nose, chin. I don't feel any deformities. Checking the ears for bleeding. There was no bleeding in the nose either. I'm moving down. We do not have any tracheal deviation or JVD. I'm noticing unequal chest rise and fall. I'm going to re-listen to the breath sounds. Breath sounds are good on the left side. Moving to the right side. I'm not hearing breath sounds on the right side. I'm going to get some occlusive dressings, isoseptic and pneumofiller. Okay, I'm going to apply these dressings. I'm going to be taping 3 sides, leaving the bottom open so air and blood can escape. Okay, occlusive dressings are applied. I also applied one to the abdomen. They're both open on the bottom to let blood and air escape. I'm going to go back up and start palpating. I don't feel any crepitus in the sternum. I don't feel or see any flail ribs. I'm moving down to my abdomen. He's an injury here. I'm going to work my way furthest from the injury and palpate the 4 quadrants. I do notice the stomach is distended. I'm suspecting that he has some internal bleeding, and he is still pale, cool, diaphoretic. I'm moving my way down. I'm going to examine his pelvis. I'm pushing down, pulling up. I don't feel any give in the pelvis. Examining his genital region. I'm going to give the patient privacy. He's good. Going down. I'm feeling for... Okay, I'm going down. I'm going to start on his right leg. I don't feel any movement in the bones. Working my way down. I still have pedal pulse. Going to move to the other side. Still no movement. And no decap BTLS lower region. Okay, checking his upper extremities. No movement in upper, lower arms. He still has a pulse. No movement or crepitus. And he still has a pulse on the side as well.
The EMTs are now taking vitals.
Unit 154, I have a 25-year-old male patient, approximate weight 125 kilograms. No medications currently. We have, chief complaint is going to be 2 anterior chest wounds and 1 right upper quadrant chest wound. Vitals, 88/60 for his blood pressure. Heart rate is going to be 120. His respiratory rate is 30. He is being bagged right now to slow those down. We applied an occlusive dressing to his anterior chest wounds and his right upper quadrant. We suspect a pneumothorax. He has unequal chest rise and fall on his right side. We also suspect hypovolemic shock. Patient is pale, cool, diaphoretic, and we are 5 minutes out.
25-year-old male at 125 kilograms, 2 stab wounds to the right anterior chest, 1 RUQ, suspected pneumothorax and hypovolemic shock. Respirations are 30 with unequal breath sounds, pale, cool, diaphoretic. Heart rate of 120, BP 88/60, and we will be waiting ready in 5 minutes for you.